In this lesson, we're going to talk about hygiene. So before we get started, the thing I want you to think about is I want you to do a little bit of self-reflection. When we talk about hygiene for our patient, consider the things that we do for ourselves. We brush our teeth every day. We take a bath every day. We do things like that. We take care of ourselves. So what we need to do when we're taking care of our patients is we need to take a little bit of that and reflect on what we would do for ourselves and do it for them. So as we go into this, be mindful of culture and be mindful of belief systems, right? So if some patients don't like using certain fragrances, or they don't like using certain products, or they want their hair a certain length or a certain style, be mindful of that and honor their wishes. The other thing you want to think about when you're dealing with them are personal preferences. So do they want short hair, or do they like a beard long? Try to honor that, but make sure that their personal preferences aren't keeping you from providing care. So does their preference conflict with care? And if it does, you're going to have to educate them. You're going to have to take the time and say, look, I know you want your beard really long, like a lumberjack, but it's going to get in the way of me taking care of your brand new tracheostomy. So for the time being, we're going to keep it nice and trimmed, but when we're done, we'll try to allow you to go back, but we want to make sure we're taking care of you first. The other thing you need to also think about fragrance and allergies. Does the patient have any aversions to any fragrances? Do they not like any? Are there some that cause them to sneeze? Do they not like, do they have a particular allergy to maybe a certain product? If they do, then avoid those and always ask about these things. The last thing I want to talk about is body image. Make sure you're promoting a positive body image. You want to, and when I say that, what I mean is when you're talking to your patients about what they like and what their preferences are, ask them what their preferences are. So do you want to, how do you like your hair done? Is there something I can do to make you feel better about yourself while you're in this really crummy situation? Because what you can do is it gives them a greater sense of self-worth, a greater self-esteem, a sense of positivity, maybe something that's just positive overall for their day. And it makes them have a little bit better outlook on maybe a bleak situation. So always be considerate of those things. And when we're talking about hygiene, we want to focus on things like skin, hair, and nails. We want to make sure that your patient's skin is always clean, and we want to make sure that you are bathing your patients on a regular basis. There's a couple of different ways to do this. My favorite, when I say favorite, the one I always usually go to is the bed bath, because it's more thorough. Sometimes you can't get it done, and you can use something like Chlorhex wipes, especially before OR. But find out what your unit policy is, find out what your facility policy is, and follow those, and make sure you're keeping your patient's skin clean. The next thing you want to do is consider shaving. If your patient, and I say consider shaving, not you, but your patient, consider shaving your patient if they request it. Sometimes it can help, sometimes they don't. Sometimes it just makes them feel good. So talk to them about it. See if there's something that you can do to help them out. Especially, I know guys, they get in there, they're in the hospital for 3 or 4 weeks, and all of a sudden they have this big gruely beard, and it's itchy. Just, hey, and I know ladies, it can be the same for you. So if there are ways that you can help your patient out by offering that to them, then do so. The other thing you want to do is making sure that you are doing really high quality foot care. Most of your patients aren't going to be able to take care of their own feet. So again, find out, hey, if you want to do their nails, I'm not very good at doing fingernail and toenail polish. You can ask my girls, but I'll give it a go. I also do it for my patients if they ask for it. So, hey, do they want lotion applied to their feet? Are there things that you can do to help them take care of their feet? Because we want to prevent dryness. We want to prevent the cracking, because both of these things over time can lead to infection. Poor foot care can lead to infection, and we don't want that. We want to make sure that we're taking care of the patient's feet, offloading their scales, offloading their heels, and keep them from getting that skin breakdown. The last thing you want to do is infection. Again, overall, we're looking at skin integrity. We're look under devices, look in between the hard to reach places, make sure that your patient's not getting skin breakdown. We want to make sure that we are really focusing on promoting positive skin integrity for your patient. Check for rashes, check for skin irritation. We want to make sure that we try to eliminate good old infection. Another thing we want to focus on is oral care and oral hygiene. I cannot tell you how many times I walked in the unit and it got missed because it was low priority. Well, you know what you need to do? You need to make it high priority. We need to make this a higher priority for our patients. Do this by completing your oral care regularly. Sometimes your units will say it needs to be done once a shift or twice a shift, or twice a day, but make sure you're taking care of it. For your patients that are on mechanical ventilation, decreased, I'll say it this way, decreased oral care leads to higher risks of infection, which increase pneumonia. So if you actually focus on doing your oral care, you can prevent infection and reduce the occurrence of pneumonia by doing your oral care for your patients. So just make sure you're using the appropriate toothbrushes and the appropriate toothpaste, and make sure all of those things are exactly what your patient needs. Pericare is a really big issue, and I want to drive some things home. So just like in our bowel and the urinary elimination lessons, we really focus on dignity and safety for our patients. So when I say dignity, we're talking about privacy. And when I'm talking about safety, I'm talking about reducing the risk of infection. So if we focus on these two things for our patient in terms of pericare, we can really eliminate these things. So when we're talking about privacy and dignity, be professional. Hey, this process is awkward, but I want to make sure that, hey, I'm here. We got to take care of your Foley. We need to make sure that we're doing your catheter care. We need to make sure that we're doing your pericare, because the last thing you want is skin breakdown. The last thing you want is skin infection. The last thing you want to do is get your patient having a urinary tract infection. You don't want any of these things. So give them dignity, offer them privacy, be professional. Use the right products. So when I'm talking about appropriate products, make sure that you're using the right products when you're doing your catheter care. Follow your unit and facility protocols. Just make sure that you're taking care of them. The other thing you want to watch out for is leaking drains or tubes. Foleys can leak. Your rectal tubes can leak. So just make sure that if you're getting any stool or urine, always make sure that you're getting that a really good skin assessment. Make sure the skin's intact. Work on keeping them clean, and make sure you're using the appropriate products. That way we're not having any adverse reactions or there's any irritation. And when we talk about things that you can do as a nurse, we really want to focus on autonomy and independence for the patient. Make sure that you're encouraging your patient to participate if they can, so that they have a better sense of self, so that they have a better positivity. They feel like they're actually accomplishing something. And look at your patient's understanding of hygiene and assess their knowledge. If you realize they have gaps in their knowledge, or if there's misinformation, work to provide the correct information so that you can really, really promote good hygiene and care for them. Another thing that you want to do is encourage family participation. Find out who the primary caregiver is and educate the family, and then help them understand what their role is, and so that they're better prepared for when they go home. You want to focus a sense of a sense of normalcy for your patient. So you want to involve the family, you want to involve the patient, you want to make it a team effort to make sure that they work on their hygienic care. And today we really focused on tissue and skin integrity for hygiene. We've also focused on safety through the reduction of infection, and we also focused on professionalism, especially when we're providing things like pericare. So let's recap. Number one, pay attention to your patient's beliefs or preferences and consider what your patient thinks about hygiene. Always make sure that you're using the appropriate products for your patients, and always pay attention to if they have any allergies here. We want to make sure that we're avoiding any fragrances that may be irritating. Always do your oral care. You want to do this to prevent infection. Encourage autonomy. You want to promote the independence for your patients. You want to give them something to look forward to. Also, educate. Focus on finding gaps in your patient's knowledge and dispel those myths or rumors. That way your patients can understand the correct information about hygiene, and they can have better patient outcomes. That's our lesson on hygiene. Make sure you check out all the resources attached to this lesson. Now go out and be your best selves today. And as always, happy nursing.